Sorry about that, y'all. My camera went off. But I got to the driveway and I remember that I just fell into the car. Like I couldn't sit down. Like I just went like that into the seat. And by the time we got to the emergency room, the pain was so severe I couldn't even talk. They had to bring a wheelchair there. I couldn't even sit in a wheelchair. So they had to literally help me sit down. Like the pain hurt so bad. And they got me directly into a room and they gave me some morphine for pain. And then they came in and they put a catheter in. Mind you, I've never had a catheter before. I've only inserted catheters to my patients. So now I can honestly say I know their pain. That was one of the most uncomfortable, unbearable things that I have ever dealt with. Like it was so weird. But anyway, they filled my bladder up with I think it was saline they filled it up with so they could get a clearer picture inside my uterus. Because the full bladder will show a better picture. And so they did the ultrasound, and the ultrasound tech lady, she told me, she was talking, I remember she was talking about her sister, and her sister was pregnant at the time, I think, or something like that. And then it took, I want to say 10 to 15 minutes of just her searching around and taking pictures. And then when she got done, I asked her, I said, well, did you see a baby? And I remember she said, I can't tell you, I'll have to let the radiologist look at the pictures, and then he'll get back with your doctor, and then the ER doctor will come in here and talk to you. And I thought that was strange, so she left out, and about 2-3 minutes after that, they moved us to a different room, and I thought that was strange. And I don't know, I want to say 5 minutes after that, the ER doctor came in. And this is the hardest part to talk about. But she said she's very abrupt and just, I don't know, she hadn't had any patient training or how to deal with the patient, but she said, this was her exact words, so we see a heartbeat, but the baby's not in your uterus, it's in your tube, and there is no way that it can be a viable pregnancy, and we're going to have to do emergency surgery. That's exactly what she said. And the only thing I could do at that time was just cry. Because to know that the baby had a heartbeat, but it's nothing that I can do to save it, and that it will be terminated, that was one of the hardest things that I had to deal with and I had to accept. And so we were in there a couple of minutes, and then the doctor that was going to perform my surgery came in, well, the surgeon, and he just went over the surgery with me, and he basically explained everything what he was going to do. He was going to try and save my tube and see if it was able to be saved, but if it had already begun to rupture, he said he would just have to remove the whole tube along with the baby. And so they took me to pre-op, and they got all the IVs and everything started. And I remember I had the sweetest nurse, and I told them I was for real. I said, do not let me die. And I remember when they got ready to do the surgery, they take you to the operating room, you're still awake, and you're laid out on the table. It was so cold, but I remember he held my hand until the anesthesiologist got through with the medicine. And I don't know, I think I made it. They told me to count back from 100, and I think I made it maybe to 94. I remember thinking around when I got to 96, and I was like, oh, I'm not feeling nothing. But by the time I got to 94, I don't remember anything. The next thing I do remember, though, is waking up and post-op, and the nurse, I remember just groaning, and the nurse was like, you're in pain, honey, huh? And all I could do was just shake my head, because I was kind of still out of it, still kind of loopy. And she said, I'll get you something for that. And then, I don't know, like the rest of it is just like a blur, because I guess the medication from the surgery along with the pain medication just had me kind of in a haze. And everything just happened so quick, like I didn't believe. It's hard to like wrap your head around that this is what happened. The only time I do remember crying after surgery is when the surgeon came in and he spoke with me, and he had pictures of my tube, the inside of the tube, and I think I don't know if it was the baby or not, but I saw it right there. But in the written text, it had that the baby's heartbeat was 126, and I will never forget those numbers. And that just broke my heart. And I just remember crying. Like, that's all I could do was cry. And after that, just the whole healing process, I had a laparoscopic surgery, which means that they didn't do a large incision, but they did 3 small incisions. I have 2 on my lower abdomen area, one on my left side, one on my right side, and then one right by my belly button. It's not even an inch, maybe a ½ inch long. And they filled my stomach up with gas, like they poked tiny little holes in my stomach and filled it up with gas. Or air, should I say? I shouldn't say gas. Air. And they ended up having to remove my left tube because it had actually began to rupture. So they removed the tube and the baby at that time. So I don't know, it's very hard and very difficult. The recovery process, it took me a long time, maybe a week to a week and a half to fully be able to walk upright. It's very, very painful. Once my pain medicine would wear off, like, you could really tell, but actually, thank God, the pain medicine was able to control a lot of the pain that I experienced. So it wasn't that bad. And walking was difficult at first. For the first couple of days, walking was difficult. But after that, everything healed okay. And even the where they did the incisions, they've even actually gotten smaller. So I mean, they're still there and they're still extremely visible, but they're not bad like they were. And how I got over basically the ectopic pregnancy, well, I didn't get over it, but how I was able to come to acceptance of what happened was God. Like, I did serious prayer, I read my Bible, I put my faith in Him. And if you're experiencing that, just keep your faith and know that everything will be okay, and that it's nothing that you did and it's nothing that you can do to prevent. So basically, just pray, keep your faith, and have a strong support system, and just know that everything will be okay. If this helped you in any way, I'm so thankful. Feel free to contact me in my inbox, or like and subscribe to me, whatever you want to do. I will be praying for each and every one of you going through this situation. It's not an easy situation to deal with, but you will be okay and you will overcome this. Thank you guys for watching, and I'll see you later. Bye.